Hi, everyone. Welcome to the audio and video podcast of the Cleft Palate Craniofacial Journal. I'm Pat Chibbaro, and I am happy and grateful to be the multimedia specialist and host of this podcast. I'm really excited. I always love seeing papers that are team efforts and multidisciplinary, and so I'm really glad to be able to present this paper, which is Health-Related Quality of Life in Mexican Children and Adolescents with Non-Syndromic Craniosynostosis. The authors are Julieta Moreno-Villagomez, Miguel Castillo Mimila, Guillermina Yanez Tellez, Belén Prieto Corona, and Antonio Garcia Mendez. So I'm really happy to have one of the authors, Julieta Moreno-Villagomez, who said my Spanish pronunciations are good. Is that right?
Yes, you did very good.
Thank you so much. As I was telling her, I have two son-in-laws. One's from Guatemala City and the other's from Mexico City. And so I have to keep practicing my Spanish. So tell us, first of all, this paper I'm really glad that we're presenting this now so that people can look for it when it comes out either on Online First or in the actual journal, which is now everything is online anyway. But so it's been accepted, but it hasn't yet at the time of this podcast been published. So be on the lookout for it because it's a really good paper. So Julieta, first, what's your specialty? Because you worked with a group. What's your background?
Well, I am a psychologist. I have a master's degree on clinical neuropsychology, and I have a PhD in neuroscience. I have been a professor at the National Autonomous University of Mexico for 8 years, and I have been a research assistant for 3 years now in the same institution. I'm the supervisor of the clinical practice of the students that are pursuing a master's degree on clinical neuropsychology. And since I was a student, I have been doing research on the development and cognition of children with non-syndromic craniosynostosis. And
You've been busy.
Yes.
Very.
And also I am involved in other projects related to the assessment of the cognition in neurological diseases like Parkinson's disease.
Wow. No, and I think it's really important to be looking at kids with non-syndromic craniosynostosis because there's much more literature, I think, about kids with syndromic craniosynostosis. So I'm really, I'm glad to see papers that come out like this, and I'm sure all the readers will as well. So what motivated your group to study, this particular issue?
Well, specifically for this paper, we saw in the literature that some works reported difficulties in care-related quality of life in children with non-syndromic craniosynostosis, especially in the school and emotional functioning. So we thought that it would be interesting to use a validated questionnaire for Mexican population to see if these results were similar in children with a different social and cultural background. Our previous work were done when children were toddlers and in preschool. So now that they are older and they have developed the abilities to answer structured questionnaires about their well-being, we wanted to know how they perceive it.
Really, I'm really glad that you studied this. So maybe you could give a bit of an overview of your project for the listeners and the viewers, and then of course once it comes out, they should definitely read the full paper. Go ahead.
Yes, the objective of this paper was to assess the health-related quality of life in children and adolescents with non-syndromic craniosynostosis who had craniofacial surgery and compare it to children without craniosynostosis. The assessment was made with the Kids Screen 52 questionnaire that identifies children at risk in terms of their subjective health. And the version that was used was adapted and validated in Mexican population. And the questionnaire has several domains that assess psychological, social, and physical well-being. And we sent that questionnaire via mail or chat to the parents of the children, and they asked their children to answer it. The participants were between 8 to 17 years old, and there were 53 participants, from which 27 had non-syndromic craniosynostosis and 26 without craniosynostosis. And we compared the answers between both groups, and the two groups were similar in almost all domains, with the exception of the social support and peers domain, on which the children with craniosynostosis had a significantly lower score. And this domain assessed their relationship with other children, the quality of the interaction, and the ability to form and maintain friendships.
Were you surprised at that? Was that a finding that you expected to see, or were you surprised with that?
Well, we find more surprising that certain domains were reported as not affected. For example, specifically the self-perception and school environment, because previous papers have stated that adults with craniosynostosis have appearance concern, and that there are several studies that report that these children are at risk to develop learning disorders. So the majority of children that we assess reported good self-esteem and good school adjustment. And these results may show that Mexican children with non-syndromic craniosynostosis have coping strategies that allow them to perceive a good quality of life.
Really interesting. As you're talking, I was thinking, did you find within that craniosynostosis group, because I know you said it was age 8 through 17, and I'm wondering, did you find a difference by the younger kids or the older kids in terms of some of those findings? I'm guessing you did, because I'm just thinking sort of developmentally, 8 and 17 are very different in terms of their socialization, peer issues, that kind of thing.
Yes, we did a comparison also to see if there was any difference between the older group and the younger group of the sample, but we didn't find any difference.
Interesting. In that paper, then, was there anything that, when you look back on papers that, projects you've done and papers you've written, when you look at that, were there any things that you left out or you wish you had included, or you feel, when you look back, you feel that it was complete?
Well, of course, always is better to have more participants, but with the condition that is not that frequent, it's difficult to recruit more children. And that was the reason that we didn't do a statistical analysis to see the difference between types of craniosynostosis. So for us, it will be important to see if the health-related quality of life is different between types of craniosynostosis.
So is that another project that's happening now? Are we going to see that next?
Yeah, well, yes, I would like to keep recruiting participants and see if we can gather a bigger sample with different types of craniosynostosis and compare the answers.
And did you, how did you get the control group? Where did you get those children from?
Oh, well, one of the difficulties that we faced was recruiting the control group, because the parents of children with craniosynostosis are used to have a lot of clinical assessment and clinical studies, so it's not that difficult that they finish the study.
Right.
But when you recruit the control group, it's difficult to that they finish the whole assessment.
Yeah, I think that's over the years. I'm sorry to interrupt. Over the years, when I've talked to authors, there's always, this, the challenge of the control group. Getting them on board, and sometimes the groups are really lucky because they have like a big pediatric, general pediatric groups that they can recruit. But that seems like it's a challenge for a lot of authors. So I'm sure that moving forward with more studies, any other ideas of how you can, what other avenues there are to recruit control? And I ask you this, I think also for the benefit of other researchers, especially young researchers who might be listening to this.
Well, we recruit the control group through snowball sampling. And also we have some connections with the university and some schools. So that's how we recruit the control group. But still, it's more difficult to gather the control group than the craniosynostosis group. Yes.
Yeah, so I guess whenever you're doing research, you really need to know that, what those challenges are going to be. So, but, it looks like now you're going to build on this, which I think is always, which is always a good thing. So then what will we see next? So what you mentioned that you're going to try to look at it by specific craniosynostosis types.
Yes, we will keep recruiting more children and see if we can gather a bigger group of different types of craniosynostosis and see if there is a difference between those types. And also we are assessing some other cognitive processes. So we are continuing doing that.
Well, I think it's really important work, and I think it's nice to have a team working with you. So besides you as a psychologist, I gave the names of some of the other authors. What were their backgrounds? I think it'd just be interesting for the listeners to know who participated in this. To it really takes a village.
Yes. Well, almost all authors, we are psychologists, and Dr. Antonio Garcia Mendez is the chief of the neurosurgical team.
Great.
So we work very close with him to gather the group with craniosynostosis. And the other authors, we are psychologists and have the master's degree in neuropsychology. And and Dr. Guillermina Yañez, Dr. Belén Prieto, and I have the PhD in neuroscience.
So for you as the psychologist, what will you do with the information that you've gotten so far? I wonder what, you always want to know what are you going to do in your own practices, for example, or on the team with the information that you got about these children? Will it change how the clinicians intervene with them, do something different? Any thoughts on that?
Yes, of course. When we see the parents with children with craniosynostosis at the beginning, they are, of course, worried because they don't know what to expect when
Right.
the child gets older. So I think that this information is important to them and also to the clinicians that treat people, children with craniosynostosis, to know what to expect years after the surgery was made.
Right. Yeah, I think that's important in non-syndromic craniosynostosis because often, once you get through that initial procedure, and hopefully only one, obviously sometimes there's more, but you don't tend to see them as often or as much as children with syndromic craniosynostosis. So I think it is, it's important to look at those kids along the way. So I'm really, really glad that that you're looking at this, that, and I was the nurse practitioner on the team for over 30 years. And, I think that the input from the psychosocial team is very important for the surgeons because, their job is to do the surgery. And they really do rely on us to really help them understand how these kids are doing, and how they're doing as they get older. So really, really good work. I wanted to reintroduce the paper, which we're going to keep looking for either on online first or in the journal itself. But I wanted to read the paper again, and the authors. It is Health-Related Quality of Life in Mexican Children and Adolescents with Non-Syndromic Craniosynostosis. And the authors, Julieta Moreno-Villagomez, Miguel Castillo-Mamila, Guillermina Yanez Tellez, Belen Prieto Corona, and Antonio Garcia Mendez. I'm very proud of myself. I think I did even better this time, Julieta.
Yes.
And, yay! And they are from a couple of different places. The Neuroscience Project, Facultad de Estudios Superiores Iztacala.
Iztacala.
Iztacala, Universidad Nacional Autónoma de Mexico. Oh, Tialnepanta, that was a hard one. Wow, Estado de Mexico. Yay, I got that one. And the Pediatric Neurosurgery Department, Hospital General de Guandencio Gonzalez Garza, Centro Médico Nacional La Raza, Ciudad de Mexico.
Very good.
I did it. So, Julieta, thank you so much, for taking time to join us. And I hope, are you by any chance coming to our meeting, at the ACPA meeting in Colorado?
No.
Oh, well, maybe we'll see you along the way, but, certainly your paper and you will be available very soon to our members and those who read the Cleft Palate Craniofacial Journal. Really important work. Keep up the good work. And thank you. I hope I get to meet you in the future. Thank you.
Yes, of course. Thank you very much for having me.
Absolutely. Take care.